KRON 4's Plastic Surgery Today with Dr. Stanley Jacobs.
The doctor is here. You know who I'm talking about, Dr. Stanley Jacobs. And he has brought along a couple, and I do mean a married couple that came to you.
Right.
And I don't even know, we should show a close-up before I even say what they had, because they are 6 days post-secret. And I gotta say, if you guys were out on the street, I wouldn't be able to tell. So tell us what they had.
They both had mini facelifts where we said all I want is this kind of thing, some tightening.
A little tightening.
So they had a surgery.
Okay.
Paul actually had his under complete local anesthesia. He was talking us, cracking jokes.
Because he's a man. Yeah, I love that.
Could be.
Right, Paul?
We won't do the gender thing just yet. And then Robin had a little sedation.
Yeah.
And actually I saw them 4 days post-op. They also had the TCA chemical peel we talked about last time that I think is better than IPL and photofacial.
Right.
And he had a lot of sun damage, over the years, and some previous skin cancers and things. Robin just had a lot of sun damage.
Right.
And so they healed differently.
Okay, so yeah, so Robin, I mean, let's talk about that. You didn't just want the pull. You had, like, what I've been complaining about forever, the brown spots.
Right.
So you had all over your face a lot of brown spots. So, Doc, you had to not only tighten her up, but Robin, you wanted those gone.
Right.
So, but I'm looking close, and maybe we can get a close shot of your face. It looks fabulous. I don't see a freckle or brown spot on you.
Yeah, I mean, I have 4 children, so from pregnancies and also all my sun damage.
Right.
And I'm just at a time in life where I just want to look a little fresher and a little,
6 days. Six days ago.
Exactly.
So you got it. Look at your smiling.
It's amazing.
And then you got the braces going. You're going to be a new you in a minute.
Yeah, I know.
How old are your kids now?
Well, my oldest is 34. 34, 32, 26, and 24.
So mom and dad go in for the twin face job. And what did the kids say?
Well,
What? Were they like, you're crazy at first? Were they?
I was like, what are you doing? Yeah, of course. But they're okay with it. They're great. They're supportive.
Yeah. You're like, you kids, you had your turn, I'm taking another.
Exactly.
Right? I'm taking another turn. What about you, Paul? What about for a man? I mean, sometimes it's hard.
No, he was recalcitrant to this. He didn't want to do it.
Absolutely.
He was like, yeah, whatever. Now you should talk to him.
Because I say it's hard to be an aging woman, but, it's a little more accepted when we do something. For men, sometimes they don't give you the slack.
Well, it's a little different for me. I was part of this, I think we've talked to you a little about the water experiment that we've been doing.
Right.
And that's part of me. I do that. So I actually thought, well, I'm not really going to have anything done with my face. I'm just going to go in and have this little thing taken off that we burned on both sides of the face.
Right.
And so I walked in there without any anesthetic at all, and I looked up, and there was a picture of me that Stan had just taken when I walked in. And it sort of looked like a mugshot of an 80-year-old guy in for a DUI, and I went, oh my.
Oh my God! I look like. How old are you? Can you tell? Will you tell us?
I'm 68. And I looked at the scene and I went, oh my.
Okay, so there you are, 68, looking at yourself, frightened to death.
Yeah, I just saw that and I said, okay, Stan, pull everything you can get.
Okay, okay,
and so look at that. I mean,
you had that on your skin?
Yeah.
Well, that's the burn.
That's the burn. Okay, I got you. Well, I don't see it now.
But I mean,
that's what's removed.
All right.
It's the overall shot.
Okay, let's check it. I'm waiting to see that. Do we have? Oh, we don't have the after shot because we have you here.
No, because it was last
Take another
Thursday.
close shot. See,
We've got Robin's
6
pictures
days
too.
ago.
Yeah.
Oh, we have your before and after too, and I'm just
before.
really checking out the shot here.
You want to get the side view?
Well, no, yeah, exactly. Here, I'm going to take my little thing with me because I just want to point out. So, I mean, I do see here. If you guys can zoom in, you still get just right here is where it's not going to be a scar, but it's only 6 days. So that's what you have right now. That's the only way I could tell that you had anything done at all.
And I want to tell you, there's absolutely nothing to it. I mean, we just laughed it up the entire time. I didn't have any drugs. It was really fun.
All right, well,
I recommend it. I'm going to have it every 2 years.
And tell him, no, he refuses people if they're not ready. Let's take a look at your before and after, shall we? I'd love to see.
Sure.
Now that I've seen you, I want to see the before, if that's okay.
Pictures, yeah.
Robin, can I ask how old you are?
I'm 53.
53. Okay, let's see the before shot. Okay, so there. Well, you look very nice. I have to say, no makeup or anything. You look beautiful. Okay, so let's see. This is the before shot here. I'm assuming we're gonna probably have a side, side shot. And again, that red spot's because you're doing a study thing.
Right.
So there's the skin. Okay, and then now I always like to get a really good look, and then there you are. Okay, so yeah, it's just I'm just surprised you're not puffy, you're not red,
No.
you're not. I mean, it's all 6 days.
Because you know what's happened is that we in our field have been trying to go the other direction, bigger procedures and invasive things, and then
Right.
realizing that if we listen to people, they just go, all I want is this. And the lifestyle lift, which I think is a good idea, but you know, the issue I have with that is that some of the doctors aren't, you know, have the same right experience, I think. And so what happens is that we've taken that idea, which I think is a good concept, except I've done, you know, 500-600 of these cases, and just giving people what they want. And with local, we're now doing them in San Francisco. They don't have to go to Healdsburg.
Right.
So, because it's at a local, we can do we can do these procedures here. They can, you know, somebody can drive them home, and they go back to work in 4 or 5 days.
You guys look great.
Thank you.
I gotta say, secret's out now, though. Everybody knows why. All right. So if you have any more questions, of course, about anything that you've seen here today, you can always contact Dr. Stanley Jacobs at his website, drstanleyjacobs.com, or at the phone number 888-279-9777. We'll be right back.
This segment is sponsored by Dr. Stanley Jacobs.